Hello everyone, good afternoon. My name is Mary Mudhuri from Jacaranda Maternity. I'm here to talk about breastfeeding, especially the challenges mothers get through cracked nipples. So feel free to listen to me, ask any questions. I'm here to answer you. Then maybe we'll start with why do we encourage our mothers to do breastfeeding. I think breastfeeding is the first feeding of our baby after birth, which should be initiated within 1 hour at birth. When you get a baby who has been delivered and we initiated breastfeeding within 1 hour, we are assured that that baby is going to have the right immune system. Also, the baby is also going to bond well with the baby, and the baby will also have no challenges during the growth. So I would like also to talk about the benefits of breastfeeding before we talk of the cracked nipples. The first thing, especially in breastfeeding, brings about the bonding between the mother and the baby. Breast milk also prebiotics, which helps the baby to have the immunity against diseases. So we encourage our mothers who deliver to breastfeed their babies within the 6 months. That is exclusive breastfeeding, where that you are not supposed to give any supplement unless if it has been indicated by the doctor. So another advantage is that the mothers who breastfeed their babies, they get the stress. They are not stressed like the mothers who are not breastfeeding. Why is it that the mothers who breastfeed their babies are not getting stressed? It's because when you get hold of your baby and you attach the baby to the breast, psychologically that mother feels happy. That mother is emotionally well because the baby is connecting well, and that is coordinated in the brain. So most of the time when a mother is breastfeeding, it feels that the mother is psychologically supported, unlike the one who is not breastfeeding the baby. So another thing is that babies who breastfeed, they increase their weight well, and also their immunity gets well. So the mother who is breastfeeding the baby well will not visit the hospital soon like the mother who is not breastfeeding. So as we normally encourage our mothers, not only us, even the World Health Organization encourages mothers to breastfeed exclusively for 6 months before supplementing. Now I'll talk of the challenges which mothers get, especially why should a mother not breastfeed. Some of the challenges is, the major challenge is the cracked nipple. I know that is not something which a mother will like enjoying because it is very, very painful. Now, how can we avoid the mother to get a cracked nipple? The first thing is that through support. After birth, we normally support our mothers we support them so that they are able to breastfeed their babies. The first thing is on the positioning. Position is where now the mother is shown. We like showing our mothers how to do it. We don't like doing it for themselves because we are here with them for a few days, maybe 2 days or 3 days. They go home, and when they are left alone and they were not shown on how to breastfeed, they get those challenges. The cracked nipples comes as the main reason is how to position the baby. And before we finish this, I will demonstrate on the right way of positioning the baby, how you are supposed to hold the baby, how you are supposed to be seated, how you are supposed to make sure that baby is latching well on the breast. Another thing is that we get cracked nipples, especially if we concentrate on one breast. I know we are supposed to alternate, but when you make sure that the baby is on one breast all the time, we know that now that maybe the other breast which the baby is not latching becomes, I think it will become hard because there will be accumulation of milk. So when the baby is given that breast, the baby feels that the breast is so hard that they cannot latch well. It can lead to cracking of the nipples. So maybe for the positioning, before we move out of that, it's always good to have the baby. If you are holding the baby on your left hand, You are supposed to do the way I'm doing it. Here is my baby. My baby is called Clara. I assume this is a newborn. It's a way of demonstrating. You make sure that the hand of the baby is on my elbow. I think you can see what I'm doing. And then the arm should be lateral at the back of the baby, and my hand should hold the bum of the baby. Then there should be skin contact, or the baby should be close to me. I should not be wrapping the baby with so much clothing, which I'm going to make my baby far away from my breast. The baby should just be near. You can see that as I'm holding, the baby is just right at the breast. Then I should also make sure that the nose, it's not covered by my breast, because when the baby is breastfeeding, they also need to breathe well. And now there's the nipple. Like now, I'm not going to get out my breast, but I have a breast here to demonstrate. You can see I have the nipple here, and I have the areola. So the nipple, it has let me use a hole, ama iko na shimo yenye inafaa kuinject hiyo maziwa, si ndio? And now the areola, the black part, it's where there is storage of milk. So that you can have effective breastfeeding and proper latching, the baby should always open the mouth. When the baby opens the mouth, should always make sure now you trigger the nipple to the baby's nose. The baby realizes that there is breast coming, and there is something coming. Then the baby opens the mouth. After opening the mouth, you slip in the nipple inside the mouth and make sure that part of the areola. Most of it, partly, it can be all of it. It depends on the size of the breast. But we encourage mothers to make sure the half of it or all of it is inside the baby's mouth. The aim here is to make sure that the nipple is just inside, directly inside, in the hand part of the mouth. That is the part where now the tongue is not going to have friction with the nipple. When you don't latch the baby well, the tongue, it's very rough, and it is the one which makes the nipple to crack. So make sure that the mouth, the soft part of the mouth, it is straightly lying on the areola part, and you should make sure the nose is exposed, and also the chin of the baby. The chin should always be lying on the breast. It should be lying directly on the breast. If you see that the chin of the baby is not touching the breast, you know that baby is not well latched. But if the chin is touching the breast and the baby is suckling, the only way you can know that the baby is suckling well, there will be a swallowing effect. You feel that the baby is just sucking and swallowing. There shouldn't be a swallow following it, so that now that you know that the baby is getting something. So proper latching is the key. And if what happens if the nipples are cracked, there is no harm. You still encourage the mother, because if the nipple is cracked, I know it is painful, but you still encourage the mother continue breastfeeding the same breast. Whatever contact is, some of the mothers will ask, why should my baby suck that brand? Is it important there is brand coming out? If you do proper latching, I know there will be a bit of pain before, but after it goes away. Don't worry, just breastfeed. Whatever content is from the mother, it is not harmful. So whatever will be coming out, the baby will be swallowing, and part of it, most of it is milk. Ignore the brandy part, because if you stop breastfeeding that breast which is cracked, what will happen? It will end up to mastitis, or you might have abscess. If it is difficult completely to breastfeed, we can encourage the mother to express. And expression, where after you express the milk, you feed the baby. Because now if you don't make that milk come out, the baby will not get enough, and that breast will be even worse. So you still continue encouraging to breastfeed. Questions? Okay, there's a question here. How often should I feed my baby? That is a very good question. Babies are always fed on demand. If the baby needs to feed, you feed the baby. But the baby feeding time, it depends. So most of the baby can sleep even especially the newborn can even sleep the whole day. It's now the mother to know that if I've breastfed my baby, especially we encourage mothers not to breastfeed. It depends with the feeding pattern, but we encourage the mother to breastfeed not less than 20 to 30 minutes. So if you feed the baby 20 minutes, it depends with the content which is coming out. There are babies who are well fed, the others who are not yet, you can go even to 40 minutes, depending on the babies. Here it is case by case. But now the next feed after the one you knew, if the baby sleeps after feeding, you are supposed to wake the baby maybe after 2 hours. Don't let the baby to sleep so much, because if they are not feeding, there will be other consequences. So it is feeding on demand, not less than 20, 30 minutes, 40 minutes in one breast, or during that period of breastfeeding. Then subsequently, you can wake the baby after 2 hours. Is it normal to feel pain while breastfeeding? Yes, it is normal, but what I can say, most of the pain always comes when there is poor latching. Where you give, when you are latching the baby and you know you have only given the baby the nipple, it has to be painful, because the nipple is very sensitive. The nipple has very sensitive organs. The nerve endings of the nipple, they are very painful. Even if you pinch yourself, even without the baby breastfeeding it, you feel a lot of pain. So to avoid that pain, we always encourage to do the proper latching. Yes. Then how can I increase my milk supply? This is another question. How you can increase the milk supply is just the mother should always be psychologically prepared from breastfeeding. The mother should be at peace. That needs a psychological support. The mother should also eat balanced meal. We don't have a specific meal where I will tell you go and eat this and this, it brings milk. Those are myths, but make sure that you eat balanced meal. Balanced meal should have protein, carbohydrates, and vitamins. Don't mind what kind of meal is that, but it should be balanced. And then take a lot of fruits. If you take a lot of fruits, you'll be well dehydrated. And you are well dehydrated, you produce milk. So take balanced food, take plenty of fruits. Yes, and then you should be at peace, because we always say that breastfeeding coordination is at the brain. So make sure that you have nothing which is interrupting you during breastfeeding. Especially, let's talk about the phones. You are breastfeeding, maybe the baby is breastfeeding, you are talking over the phone, maybe you are not happy, maybe there are others who are emotionally down, maybe you are crying, and when you are, those things affect the baby, because we normally say breastfeeding coordination is at the brain. That's why we always encourage the mothers, and that's why even you have maternity leaves where you are supposed to fully take care of your baby and yourself without any interruptions. So make sure that you have a environment is very conducive, you are happy mom, you are feeding well, and you are supported. Breastfeeding is very important for our babies, so should always do the best as mothers. Then what are the signs for a blocked? What are the signs for a blocked milk duct? So the signs for a blocked milk duct, I think now that is the way you can know that there is a duct which is blocked, the milk will not be coming out. Maybe you feel a lot of pressure from the breast, but even if the baby is sucking or you press that breast, you cannot get any milk. And it can also be very painful, it can also be inflamed. What you can do about that, you can do maybe if you feel, you can do some massage. You can do massage around the nipple, around the areola. You can do also warm compressions. Yes, warm compressions we always do when that maybe you think it is not inflamed. Maybe when it is, if you see your breast is reddish, it has mastitis, warm compressions will not really help, because now it is going to complicate. That you can use cold compressions. But for the where you think that there is a blockage, I think the warm, not hot, warm compressions and massage can help. So I think I've answered the questions. Then we go to the other questions. So breastfeeding is very important. I know you can prevent cracked nipples. When you start your antenatal clinics, we normally educate our mothers on breastfeeding, especially during the birth class. And even on one with the antenatal clinics with the nurse can, if you had a previous history, maybe you had a cracked nipple, if you had breast engorgement, if you didn't have milk, it's good to mention when you come for the antenatal visits, so that we can prepare you and walk the journey with you. We give you the hand device, what you've been doing for the breast as we prepare for delivery. We have birth class in all our facilities where we normally teach our mothers on breastfeeding, about exercises for preparation of birth of the baby. So you know, our journey in Jacaranda, we started very early. The moment you realize that you are pregnant, we are going to talk all about that. We talk even about nutrition, because breastfeeding is all about nutrition. If you are not eating well during the antenatal clinics, and now you come for delivery, you are weak mother, you are anemic, now you see, now you are going to compromise your baby, you also begin to compromise your immunity. So we encourage that mothers should check on their nutrition and also advise them to come for birth preparedness, so that we can give you more information. Is feeding while sleeping healthy? Okay, I say it is healthy, yes, but we always encourage the mother, you should always be alert. Maybe I wouldn't say it is unhealthy, because there are situations you feel that maybe you are healthy, you feel you are tired, it is around, you can breastfeed your baby while sleeping. But now do the position, the aim of breastfeeding is how to position the baby, the proper arching. It doesn't matter if you are seated or you are lying, because now if I tell you at night wake up and breastfeed the others, you feel that it's not, it is the ideal if you are able to wake up. But if you feel it's not, just you can lie on your side, make sure now you are alert, you cannot sleep while breastfeeding the baby, and now you connect and make sure the baby is well latched at the nipple. Yes. Then like both mom and child. Sorry? Oh, the same question. Okay, so the mom is asking Should I breastfeed when I'm lying down and still with my baby? Yes, you can do it, but make sure the baby is latching well. Make sure the purpose here is to latch the baby well. Make sure that the nose is exposed, the chin is touching the breast, and now you can see the mouth is wide open, and you can feel that the baby is breastfeeding and at the same time the baby is swallowing. So you have to be observed, don't just give the baby the nipple and then you sleep. You know why we discourage that? It's because most of our moms, if you are tired, the baby will just grab the nipple and there you go off, you sleep. You forget the baby was breastfeeding, the baby might stay there for 1 hour, and because the baby is not getting enough milk, we normally say that the nipple does not have milk. The areola is the one which has milk. That is why we encourage the babies to latch well so that they reach the areola, so that the enough milk will flow to the baby. So you realize when you wake up, the nipple is already, so it is very painful because that is what you give the baby, and the baby is getting comfort from it. Even though the baby is not getting milk, you will spend most of the time there. But if you do proper latch, the baby will be fed by within, tumesema 30 to 40 minutes, your baby will be fine, and also will have time to sleep. So yes, but with the proper latching. Ni wakati wa maswali, so tuendelee kuuliza maswali. So what causes the creaking sound after the baby is well latched? The creaking sound. Most of the creaking sounds come as a result of poor latching. Another cause can make the baby to creak, that sound I'm thinking of, is when there is a lot of pressure coming out if you have a lot of milk. Now if already your baby is well latched, you can attest to that, and you feel the same, maybe the milk is coming out with a lot of pressure. You can control it. Where that when you make sure now the baby is breastfeeding, na unaona hiyo inatoka, inajua the milk comes from the ducts. You can just apply pressure above where the baby is latching to avoid that pressure going to the baby, so that now you can relieve the pressure. Or you can also discontinue the baby from breastfeeding, where you normally hold the chin of the baby. When the baby is at the breast and you want to detach the baby from the breast, you can always press the chin here gently, the baby will release, and then you put the baby away for some time. Maybe the baby can burp and then take the baby back, because it's the way the milk is coming. Maybe you have a lot of milk, the baby is suckling, and the baby is swallowing a lot of milk and at the same time swallowing a lot of hair. Can I breastfeed when I am sick? Yes, you can breastfeed. It depends with the sickness, but if the doctor has said continue breastfeeding, we go as the doctor's prescription. If your immunity is not compromised, maybe you are not clinical, if breastfeeding is not affecting your sickness, you can breastfeed. But if now you are sick and now the doctor says that if the baby breastfeed, you are going to compromise your immunity, you will be advised accordingly. But if you are sick, like the normal, maybe you feel you have pneumonia, if you have what we call the flus, always prevent your baby by putting on a mask. But you continue breastfeeding. I think I've answered your question. When should I introduce the bottle to the baby? Bottle feeding. We normally say If it is possible, exclusive breastfeeding for 6 months, unless otherwise. So I think at 6 months is the same period we are going to introduce baby on calf feeding. We don't want to talk about the bottle feeding because of now the hygiene part, but if you use a cup it can be better. But we normally say when you start weaning is the other, we introduce bottle feeding, because when you do that, you don't want to have any nipple confusion during that time of the right breastfeeding, because the baby can choose the bottle and now neglect the breast. Then what should I do if I have a blocked milk duct? I think I answered that before. There is someone else who asks the same. My child since birth doesn't hold breast for long. He sucks for 2 minutes, but he is still handing weight. Is everything okay? Hold breast for long. He sucks for 2 minutes, but okay. This is also a good question, because I said that it depends with every baby's pattern. Maybe the 2 minutes, but the 2 minutes are very low. If the baby is handing weight, it means that you have enough milk where the 2 minutes the baby is able to get enough. But now you do the frequency. If the baby is just breastfeeding for 2 minutes, why can you continue doing it frequently? Don't make the baby sleep for long hours, like 2 hours, 3 hours, 1 hour, because now you see the baby is just staying at the breast for only 2 minutes. You can continue the same, because it's like a pattern the baby has embraced, but now you increase the frequency. I think I have answered you. Yes. Questions are over? Okay. Okay. Pamoja ni refu. So we have birth preparedness classes. I think when all mothers attend those birth classes, all the anxieties, the motive of having birth classes is to prepare our moms for delivery, and also breastfeeding, especially breastfeeding, because whatever will come here now, that you have been having a pregnancy for 9 months, but you are saying we breastfeed for 2 years. I think in breastfeeding, it's all about the mother and the baby. So it takes a longer time. So we need to know more about this. So in we have a branch in Kahawa West. The birth classes are always happens on Mondays. Then in Umoja, we have birth classes on Thursdays. In Luaka, where I'm located, we have birth classes on Fridays. You have all your questions answered. Birth class is a place where mothers interact. It's not on one session. It's where more mothers come across, they share experience, they are given information, and then they ask questions the way you have asked them, and we are going to support you. So we also have, in Ruaka, we also have a pediatric ward, where maybe if you have a sick baby, we can admit your baby, you can take care of your baby. We have pediatricians in all the branches. So the baby is well catered for in Jacaranda maternity, and we are going forward looking that we all have a birth class talking about breastfeeding. We also have a lactation consultant, especially in Ruaka. We have Erin who takes care of mothers who have challenges with the breastfeeding in conjunction with the nurses and the doctors, and also the pediatrician and the nutritionist. We want to support our mothers That consultation is free, especially for lactation. Mothers who feel that they have challenges, always feel free to come, and we're going to guide you. What makes, kuna swali iko hapa, what makes a 3-week-old baby restless? He hasn't slept since 6 a.m. in the morning. So there are so many things which can make this baby which can make this baby restless. Number one, for a mother, I think you are the best person to know the behavior of your child, because I think as a mother you are with this baby all the time. Number one, most of the things which make babies not sleep or restless or cry, by the way, number one, crying for a baby is very normal. If you get a baby who is not crying, you still have to ask, is my baby okay? But crying, it's normal, we take it positively. Number two, always check the baby. Can this baby have any danger sign, like fever? Is my baby having colics? Have I overclothed my baby? Maybe the baby feels the environment is not conducive. Yes? Is the baby passing stools as it is indicated? So it's you, the mother, now to check. The baby also can cry because the baby has not had enough sleep. Maybe the baby has been awake throughout the night. And now even if the baby they want to sleep, there are some babies who are really disturbed with the sleep. Before that sleep comes, they have to be restless. So there are so many factors. If the baby hasn't having fevers, check on the diapers. If the diapers are okay, is the baby as the baby breastfed enough? You as the mother, I know you know that my baby has really fed enough, or it is. I think that the mother is the best position, but there are so many factors I have said. Just keep close to the baby, keep on checking, and most of the cases for especially these small babies, the newborns, we always encourage the mothers. Whatever you do for them, do it yourself, because some for those classes, we show you how to do them, like bathing the baby, examining the baby for any danger signs. But if you delegate those duties, we might miss something. Maybe the baby has a constipation. You yourself, you are not checked in diapers, you cannot know someone else did it. And it's good for a mother to keep on changing those diapers, washing your baby yourself, touching the baby. You know that my baby has fever or not. You know that my baby is happy or not through your observation. So always let us be keen with our babies. We are going to learn to see the abnormals all the time if we are close to them. Then talk of pumping breast milk was told it's not. Talk of pumping breast milk was told it's not healthy. Is that true? Okay. It depends why you are doing the pumping. We normally say that breastfeeding. If you breastfeed your baby, we have said that you connect with your baby when the baby is attached on the breast. But now when you pump, what happens, especially with the pump, there is a disconnect, because now maybe you are pumping this milk and then at the same time maybe you are feeding by a cup. You know the babies can go for options. No one's like getting tired. If you are used to expressing milk and giving the baby by a cup, the baby might choose the easier way because the baby is getting satisfied very easily with the cup. With the breast if you give the baby the breast, they get also tired. Maybe they go for that. So that's why we normally say, if you are able to express, and if you want to express, I know using the hand expression is the best, because when you use your hands, there is that touch, and when there is that touch, there is the flow. Everything is coordinated in the brain. With the pump, it gets enough milk. Yes, it is a way of expressing milk, but now there is a disconnect. And we say, especially the pumps, we encourage maybe when you are going back to work, that is the right time to use the breast pumps, because as you express using the pump is getting out milk, and there will be more production. You also end up, maybe as you expressing and the baby is not sucking the breast, you can even lead to having a lot of milk, which might lead to mastitis, because when you pump, you are making now there is more production of the prolactin, which will help with the production of milk. There will be excess of it, of which now if you breastfeed your milk, don't assume that when you breastfeed the milk it will not be enough. If you do hand expression, it will not be enough. It will. But if we are able to discourage the pump, hatusemi pump ni mbaya, but if you are able to do it, especially when going back to work that time, at least the baby will have connected with you the first 6 months. And also if you have to express, use the hand expression. I think I've answered your question. Yes. Memaliza. So our moms, I think I've answered your questions. You feel free to walk in any of Jacaranda branch. You can go to Kahawa West, Kiamombi, you can go to Umoja. And then in Luaka, you will be assistant, all your concerns will be met. You can also, I think you have all our numbers. You can also call when you can book for those lactation classes. We will give you the best support. I'm so grateful even for your time and listening to me. Looking forward for improving on cracked nipples. I think those who have listened to me and they are breastfeeding their babies, please do the right position. The right position, if you do it, you are going to minimize the rate of cracked nipples. And you'll be a happy mother. You enjoy your time for breastfeeding, and you know that breastfeeding is very comfortable when you do it the right way. Thank you so much.